Good afternoon. Everyone is joining us online apart from the candidates and the Chair, David McNeil. The Chair and the candidates are joining us by audio broadcast only. Not all the candidates had access to a computer or a webcam and speakers, and we thank you for your understanding on this. Each candidate will have 3 minutes to speak. You will see a photograph of the Chair for this webinar and of each candidate as they are speaking. If you ask a question of a candidate, in the right-hand corner there is a chat box. Please type your question in there and please state the name of the candidate to whom your question is addressed. Do type and send your questions to us as you think of them. After the candidates have spoken, we will then address the questions. The office will read each question out and the candidates have 1 minute to respond to a question directed to them at that time. I'm David to chair the session.
Ladies and gentlemen, tonight we are having the candidate session for the member at large for nursing practice to the Board of Directors of the Registered Nurses Association. This evening we have 3 candidates that will be an opportunity to do a 3-minute presentation and then answer any of your questions. The 4th candidate that wasn't unable to join us tonight. So tonight we have Leigh Baetz-Craft, Allison, Kern, and Cheryl Yost. And join us tonight was Meredith Whitehead. So I chair this webinar and try to keep us on track for the evening. And we'll start with each candidate given the opportunity to ask to address the audience with presentations. And we're going to start with Leigh this evening. And Leigh, I would ask you to go ahead and present, and I will let you know when 3 minutes is up.
Thank you very much, David. Thank you, RNAO members, for allowing me this opportunity to speak with you and answer your questions. My name is Leigh Baetz-Craft, and I have been in nursing practice for 29 years. I have been an educator, as a project team leader, but primarily as a bedside nurse, the frontline worker. I'm aware of those issues faced by nurses, especially for those working in direct patient care. I believe that my down-to-earth approach would bring a refreshing perspective and foundation to the clinical practice is changing every day, and nurses need tools, they need education and support strategies to enable them to critically appraise, embrace, or just accept changes. I believe that the member at large for practice should represent the critical mass of nurses, and to me, that is the bedside nurse. I've been with the RNAO for over 20 years and am currently the chair of the Maternal Child Nurses Interest Group. I hope to be involved with the activities that have advanced the profession and hope that my passion and practical approach would convince members that I would benefit to the board in the position of member at large for nursing practice. Thank you very much.
Leigh. We'll now ask Allison, if Allison you would go ahead and make your presentation.
Okay, very much. It's an honor to address the board and the members of the RNAO. I just wanted to provide a bit of background that's not included in my bio. I started working in healthcare in 1991 as a med lab technician in an Ottawa-based lab organization, and I was there for 13 years, working across various multidisciplinary teams at that time. I studied nursing in 2000 and then finished a Master's of Nursing thesis stream in 2012. I published an article in the Journal of Nursing and Education Practice, and I believe in lifelong learning and our achievement of nursing goals. I also hold a graduate diploma in health service and policy research, which has given me the skills to learn about how to bring nursing issues forward through the various components and levels of legislation. also hold a community health nursing certification, and at the present time I'm working as a nursing practice leader at a public health unit. My position as nursing practice leader sees me work across nursing disciplines, such as healthy babies, healthy children, sexual health, immunization, communicable disease, emergency preparedness, immunization and prevention, as well as health promotion and tobacco cessation. I believe in nursing practice, and I always strive to support the nurses within the context that they work. A framework of nursing practice is a way to standardize and help us with our decision making. So we work in various components of nursing. Nursing practice principles can be the same, and that's what makes us strong and gives us a strong language between all of the different nursing disciplines. I also promote nursing standards within EMR, which is electronic medical records, which is vastly under production within many organizations at this time. We're working with nurses in the front line, in management, in education, as well as executive nurses. I have a connection to the College of Nurses through the advisory committee and through links across the province with other nursing practice leaders. Thank you for this time to speak to you, and I will take any questions.
Then we'll come back to the questions at the end of all the presentations. I will ask Cheryl if you would go ahead and address members. Go ahead, Cheryl.
Great, thank you. I'm Yost, and I'm going to build on the bio that is on the website at this point. And thank you for the reflective opportunity. As I was preparing this, I asked some of my colleagues to identify some of the attributes that they saw in me, as well as in their colleagues, and I came up with a Coles Notes version of what that looked like: and professional, enthusiastic, dedicated, hardworking, motivated, and adventuresome, in addition to the advanced clinical skills and knowledge and leadership qualities. With the last being ingenuity and perseverance, and that's what I see as nursing today. There are many of my colleagues, or some of my colleagues, that revitalization needs to occur. Walking wounded, but others are full of possibility with the portfolio of energy. The tasks are challenging today, but they certainly are full of opportunity. I was there in the 90s when there was the Ray days, when in the name of saving money and then pay equity, as well as the cutbacks in the 90s. The pay equity, if you remember, they compared us to pastry chefs. We're anything but pastry chefs. When you look at the, I'm hearing some feedback, sorry. When I see the changes that have occurred today, so the assemblies, the AGMs, going to Queen's Park, the words that Premier Kathleen Wynne said at our last AGM, and as well as talking about expanding the scope of nursing, as the Honourable Deb Matthews, in decreasing emerge wait times and increasing access in the community. Working in remote Ontario, I now see many opportunities, those of preventable diseases that we need to move forward to decrease. I've recently worked with varicella outbreak, TB outbreak, with sexually transmitted diseases, hepatitis A, B, C, and I could go on and on and on. But we do have preventable diseases. We have to move on as well as the chronic diseases that we see in abundance in all areas, not just in where I'm working now in Northern Ontario. Lifelong learning is my mantra, and encouraging and empowering individuals and communities to support their health, their goals, and their need to promote appropriate system resources, partnerships, collaboration, and so on, is what I would like to see improvement in the team process in our system. It is our system. Thank you.
To all the candidates for those excellent opening comments. I'm going to ask Penny now. Penny, if there are questions of the candidates, and I'll address the questions to the candidates in order. Go ahead, Penny.
Actually, have no questions. We want to, are on the line. If you have any questions, please type in the chat box now so that we can share those questions with the candidates.
There are no questions. I'll take the lead to ask the questions of all the candidates. I'll give it a minute to make sure that none of the other members of RNAO have questions.
So far, nobody.
To ask a question of each one of the candidates, and we'll start with Leigh. As you think about the practice and the profession of nursing, what do you think are the biggest challenges that face the nursing profession in 2014?
That's a very good question. I think we have between what's going on in the population in terms of health concerns and what's going on in the population of nurses and how they're being educated and how they're moving into the workforce. And we also have the nurse population. So some workforce is getting older. I see where I work a lot of nurses that have worked shift work for a long period of time. Health concerns and health issues that have come with that. We've got a lot of younger nurses working with us now that need mentoring, that need the supports and the education that we can provide. And we're looking after, in the acute care world, we're looking after a much sicker population, people with all sorts of acute and chronic conditions that are home faster, so that we need people in the community to be able to support and care for these people. So it's a real challenge at this time, and with of fiscal restraints and how we're supposed to educate and mentor and manage this type of thing. I think that's one of the major things that we need to address. Thank you.
Allison, what would you think were the big challenges in the practice, in nursing practice today?
In nursing practice today, there's a lot of change coming forward with changing technologies and how fast we're expected to move and change our practice to accommodate for things like social media or electronic medical records that are being developed, sometimes without the understanding of what we need to do in terms of nursing documentation. Another issue that I see across the landscape is a shift to this idea of non-nurse managers managing nursing and influencing nursing practice. Other influences that I see in terms of nursing practice is also how research sometimes drives our practice and sometimes practice drives research. And where we need to make sure and tighten up on is how we document and how we use standardized tools to collect data assessments for nursing, so that if research studies do come, they would use our standards of practice, not to impinge upon us to tell us, well, collect this data, this is what we need. Because we have to be very clear that nursing assessment is based on the collection of very succinct data relative to where you're working. If a research study is to come in, I fully support research, but those things would be add-ons, not taking over nursing practice documentation. Another area, thank you, sorry.
Trying to keep everybody to a minute. So, what would you think would be the biggest challenge in nursing practice today?
What I see, David, is the endurance or lack of endurance that is occurring with some of the colleagues within the healthcare system in itself. And we need revitalization for those individuals, as well as we also need to, it's twofold. One is also to empower the public and the general public to build critical mass for them to care for themselves, to take more accountability for their own health. We've taken away from them over the years, and I was part of that way back when. And now we need them to do it, but they don't know how. So that's part of it right there. The chronic disease management is going to be a big challenge, and we need to move upstream, and we're having trouble doing that. We're putting our monies into downstream. We're under the waterfall right now and floating downstream at times, and we need to move upstream and get to the prevention as quickly as possible.
Cheryl, Penny, I'm going to ask you, are there any questions from the members?
We're sending them a message to ask attendees who have just joined. We're in the questions period, and you may submit your questions to the candidates here. We'll just, I guess.
In the meantime, keep things moving. I have one other question, and while those questions are coming in, the member at large for nursing practice is a very important role to the board of directors in connecting with nurses in practice. How is the connecting with a nursing practice and bringing that perspective to the board of directors? And this time we'll start with
But one of the ways would be working as a team with the other board members, because there are many contacts there that, be it with the interest groups, that would integrate in with that. We cannot do it on our own. There's not enough hours in the day, and so that work has to occur as a team.
And Allison, would you like to respond to that question? How would you connect as a board member with those nurses in practice?
That doing situational assessments with nurses who are members by surveys would be one good way, and also creating some sort of strong link, maybe with a social media or teleconferencing once in a while, where we could hear what some of the on-the-ground nursing issues are, as well as in nursing who deal with management and education.
Thank you. And Leigh, would you like to respond to that question?
Well, the best thing about being the last person to speak is that you can say, I agree with everybody else's great ideas. And I do. I think they were wonderful ideas. I do think that there is a vital need for professional and appropriate use of social media. And I see the future, Twitter, and with sending out tweets and with establishing links with nurses in communities, in hospitals, and being available to represent them. And I do give contribution and credit to my colleagues and their ideas as well. I think they were excellent. Thank you.
Thank you. And do we have questions from the members?
Do not have any more questions, David.
I will with Allison. And Allison, I will give you 1 minute to make any concluding comments that you'd like to make at this time.
I'd just like to say I'm very dedicated to nursing practice, and I do currently work, my day-to-day job is working with nurses across my agency with nursing practice issues. And I do try to instill in these nurses that we must depend on our nursing process, assessment, diagnosis, plan, implementation, and evaluation in everything we do, irregardless of whether we're in clinical practice or health promotion practice, and to ensure that we document strong and have good, strong documentation methods. Thank you.
Anything you would like to add as a concluding comment? Go ahead.
Thank you, David. I would really like to express my appreciation for the members of the RNAO who suggested that I run for this position, and the confidence in my abilities to be able to say that from a grassroots level, from a staff nurse level, that I would be a good voice to speak for the nurses of this province on this committee. Thank you very much.
And Cheryl, would you like to make a concluding comment?
To begin with, I'll start with where I ended off with the previous, and it is our system. Improvements must continue to occur to enhance the experience not only for the individual, but as well as for the provider. And that's what I'm finding is that satisfaction must occur at the front line, at every level, for the individuals that are the caregivers as well. My journey, as well as the influence of others, have left a lasting impression and has further really solidified my passion for the wonderful world of caring and skill of nursing. We as a team and members play a role in deciding important issues that affect the current and future direction of RNAO in our system. We have the ability, and now's the time, and thank you.
Thank you very much, and with that, Penny, I am suggesting that we conclude the webinar.
Yes, no more questions or comments?
So I do, again, thank all the members who have joined us this evening, and I would particularly like to thank Leigh, Allison, and Cheryl for the time and making yourself available to participate in this webinar. With that, I will conclude the webinar and thank everybody for participating, and have a good evening.
Thank you, David.
Bye-bye.